The birth of a baby is a day of joy and happiness for most people. It is exciting that after 9 months of waiting, there is a new member of the family. However, joy and excitement might not be the only feelings that can occur. Surprisingly, feelings of irritability and tearfulness can occur, especially in mothers. These feelings are usually called baby blues, and they usually occur within the first 10 days after delivering a baby. Baby blues usually go away within the first 2 weeks after delivery, but if they continue and symptoms become worse, then it could turn into postpartum depression. Increased awareness of postpartum depression to expecting families can help detect it and allow them to receive the help they need. Postpartum depression is a major depressive disorder that occurs after childbirth in 15% of mothers. Symptoms of postpartum depression include tearfulness, irritability, loss of interest in activities, insomnia, eating more or less than usual, less energy, feelings of guilt and unworthiness, lack of concentration, and thoughts of suicide and harming the child. Because some symptoms of postpartum depression are like those of having a newborn, such as lack of sleep and less energy, it makes it harder to detect postpartum depression. Why does postpartum depression happen? Although an official cause is not known, there are many factors that relate to postpartum depression. Dealing with stressful situations during pregnancy, such as money problems, teenage pregnancy complications, or even immigration status. Also, not having enough emotional support from the baby's father or from family and friends. The changes in hormones after pregnancy can also relate to postpartum depression. They can affect sleeping patterns for the mother. Birth complications can lead to a woman suffering from childbirth post-traumatic stress disorder, or CBPTSD. In a study done by Sharon Deckel, a doctor from the Department of Psychiatry of Harvard Medical School, it was found that 90% of women who suffered from childbirth PTSD also suffered from postpartum depression. Childbirth PTSD symptoms include anxiety or fear when thinking of birth, lack of emotional connection to newborn, and constant flashbacks of birth. Postpartum depression is diagnosed using screening tools such as the Edinburgh Postnatal Depression Scale, or EPDS. This tool consists of 10 questions asking about emotions such as anxiety, mood, and unhappiness, and how often they are felt by the mother. It has been found by numerous studies that postpartum depression is underdiagnosed and there are low rates of screening due to medical doctors not having the psychiatric knowledge to diagnose it. OBGYN visits and child well check visits are opportunities for mothers to be screened, but a lot of the time screening does not happen due to the mother feeling guilty about the thoughts and feelings she is having. There are many treatments for postpartum depression. One of them is interpersonal psychotherapy. This treatment helps patients talk to a therapist about adjusting to the role change, having enough emotional support, and other stresses in their lives. Antidepressant medications. These work by increasing serotonin levels in the brain, which can help improve mood, sleep, and concentration. Other treatments include exercise and massage therapy, which release chemicals in the brain and hormones in the body that improve mood and help relax the mind. Leaving postpartum depression untreated can lead to terrible consequences affecting the mother, child, and family. Children can be affected by having sleeping problems and poor cognitive and behavioral functioning. Mothers don't have a good emotional connection with newborns. Postpartum depression can lead to postpartum psychosis, where the mother starts having confusion, poor judgment, mood swings, delusions, and hallucinations. Mothers can become violent to the point of harming themselves or their child. However, increasing awareness of postpartum depression before, during, and after pregnancy can help detect it and allow families to get the help they need.